My name is Alyssa and I'm a PICU nurse. I've been a PICU nurse for 6 years, but I've been a pediatric critical care nurse for 8 years. The PICU is an ICU, it's just for pediatric patients. During COVID, they put into effect this short-term thing where we would maybe have to take adult patients, of course, like within our scope, things that we would be able to handle just with a bigger person, because the adult hospitals were getting full. We didn't end up having to take any adult patients, but it is so similar that we could have taken adult patients if we needed to. Skills that are necessary for the PICU are being organized, because sometimes you have 2 patients that are both very sick and you need to stay on top of your to-do list, because getting behind even just by half an hour could really set you back and kind of snowball effect into you losing track of your day. Another good skill to have is just being flexible, because there's always curveballs when you have critically ill patients. 1 minute things are okay and the next minute your patient's crashing, so you really need to be prepared for that and also just be flexible for whatever the day will throw at you. Nursing skills that you need, like hands-on skills, we do a lot of suctioning, so suctioning ET tubes, nasal suctioning, those are all important things. We hang a lot of tube feeds, we place NG tubes. You can get certified to place NJ tubes, which go past your stomach. We also do a lot of dressing changes, a lot of catheterizations, and those are the most important skills. Placing IVs, if you are good at that skill, it's a great skill to have. It's hard sometimes in the PICU because your patients have really bad veins, and if they're super sick, they don't have good veins, or they have 1 good vein left and you worry about not getting that precious access. So we don't really place that many IVs ourselves, but if you can, you'll be the unit champion. What I enjoy most about being a PICU nurse is just really feeling like I make a difference, especially with the parents of my patients. Sometimes they're challenging to deal with, but they're really going through probably the worst time of their life if their child is in the ICU. So it really just makes me feel like I've done a good job when I know that the parents feel at least comfortable with me being there and taking care of their child. The most challenging part of the PICU, of course, is when patients pass away. It's not always a bad thing. Sometimes it's just their time, but of course it's never easy to deal with. So that's something that you have to make sure you take care of yourself when you work in that setting, because that stuff can really add up. So you have to take care of your mental health. Pros and cons to both day and night shift, but I personally am a day shift girl myself. It's a little busier on day shift. You have to take your patient to a lot of tests and procedures, but I really enjoy the rounding on day shift because there's just more explanation of what's going on. You get to talk to members of different teams and get their insight on things, so you just get a better picture of what's going on with the patient. For night shift, one pro would be that it's a little quieter, as long as nothing crazy is happening. So a little more relaxed, but on the other hand, it's a little harder to get things done for your patient. Like if you want an order changed or if anything's happening, the attitude usually is, oh, we'll just wait for the day team to do it. If you're interested in PICU, you should try and find a fellowship program that will help ease you into, number 1, becoming a new nurse, and number 2, becoming a nurse in the ICU, because there's so much that you didn't learn in nursing school that you need to know in the PICU. And then my other advice would be to try and get a job in the hospital, or even just volunteer on the floor so people know you there. You can work as a nursing assistant or even a unit secretary, and that will just help you get your foot in the door. I feel like you just need to be there, and then they know you, and then they'll trust you, and then you can get a job there.